the attitude. We might not have all of this, but the way you talk to the patient, the way you come off, and it's the same situation with the police, which that's why I tell us most of the times, the problems in all of this is not really what coat you're wearing. It's just a matter of who you are and the kind of human beings that we're growing in society. Because this same thing that you said the police would do, how they talk to Nigerians, if you go to many public hospitals, you find similar situations from nurses as well. Not all of them, some of them. You see that same kind of behavior. There's an emergency, the family is worried. And the family members at the time when you get to the hospital, it feels like you are safe. The hospital is like, I'm going to get help now. So imagine your shock when you are there and you're seeing that the help you thought you would get isn't coming. If you look at some figures that will blow your mind, the Nigeria Medical Association in 2021 regretted what it said with regret. That's how they expressed it. They said they expressed with regret in 2021 that fewer than half of the more than 80,000 doctors that was registered with the Medical and Dental Council of Nigeria were actively practicing in the nation, which is then translating to a doctor to population ratio of 1 between 4,000 and 5,000. Now, the WHO recommendation of one doctor to 600 people. So I'm trying to put in context what the situation is. So sometimes, as much as we love to put a lot of blame on the doctors and the nurses and all of those people, let's also look at the system in general. Some of the challenges that doctors are facing, they are enormous. In the country, the medical sector, we have shortage of doctors because of the problem of brain drain, no matter how anybody has tried to paint it in the past, including the former minister for employment, labor and employment. There's poor infrastructure. It was great a thing that we had the deputy governor visit. For me, sometimes I look at it and I say, how difficult is it to ensure that all the hospitals, government-owned public hospitals, have first-class equipment, not just have the equipment, have enough of those equipment, and then a system in place that really works. How difficult can this be? I wouldn't know. That's because even people who are the commissioners will not tell us the truth about the real situation. I don't even think that the government will tell us, because at the end of the day, somebody will try to protect the image of some people. So nobody would outrightly tell you exactly what the problem is unless or except the doctors. And that will be for some of them. So there's a problem of poor infrastructure, very poor infrastructure. There are some very common equipment that a hospital should have. I bet you go to many public hospitals. I'm not talking about primary healthcare hospitals now. Let's even leave those ones out. Those are the bottom. I'm talking of the tertiary ones, public tertiary hospitals. You would find that some very simple equipment you don't have. You will be shocked they don't have it. Many of you have gone to many private, public government hospitals, national hospitals, where you have to pay to buy gloves that doctor would wear to treat you. Now, when you put all of these things in consideration, how do you think that our response to a health emergency would be effective? When even the person working in that situation is pissed, do you think that the doctors are happy that you have to go and be the one to buy gloves that they will be wearing daily to attend to your loved one who is in the hospital? It has happened to me. Daily, buy pack of gloves that they wear. Now they buy them. They are not happy with it. So imagine them in that condition. Mentally, they are already out of place. So very many of them would have little patience. So you now imagine how that in turn affects the whole work of, emergency. The fact that it's called an emergency ward, that's the first place you go to get care. The level of attention or care you get in an emergency ward, if you are to measure it on a scale of 1 to 10, how effective is it? That would also depend on the level of your emergency. There is also the problem of lack of equipment. I've highlighted that. Not to mention poor work environment. Welfare problem is huge. So when you have all these problems, would you boldly say that anytime soon we would improve on our emergency response to health crisis? Or would you totally want to blame the nurses and doctors for they are human beings too with emotions? Would you not want to blame them? Because for some of them, this is the attitude. It's happened so much that they've become used to it. So it's more like this medicine, this drug, no day. I've seen them say, oh, this drug, no day, that drug, no day. They will now refer you to go. This is an emergency, remember. You will not. Let's open the phone lines first. We'll start with that. We'll come back and tell you more. But now the question is, who takes the bunch of the blame? The doctors or the management of the hospitals or the government? Who is taking the bunch of the blame? Because they generate funds in those hospitals. What do they do with the funds? The only thing we hear most of the times is diesel. It's diesel. That's diesel. That's the major thing we hear. To keep this running, this is diesel. So what happens? Is it the government we blame? Is it the government that takes the most of the blame? Is it the management of the hospitals or the person you see when you walk into the hospital who is the medical personnel? Who takes the major part of the blame? Because if some of these things were taken care of, perhaps Ayo would still be alive. And many other victims who suffered burns in that explosion. 0817 923 0007. 0817 923 0007. You can also call 0817 923 0002. Your name, where you're calling from, and let's get your response. Good morning.
Yes, good morning.
Good morning to you.
Yeah, my name is Promise Beke calling from Ghana.
All right, Promise, please, the volume of your radio, I think you should turn it down completely or leave that in.
Yeah, I've been able to handle that. It's so
Okay.
pathetic. You see, the blame here cannot just go to the doctors or the management of the hospital. We live in a country where we have a systemic corruption. You agree with me that in the appropriation bill, either at the national or at the state, take a look at what is budgeted for the health sector. Let us study the fact that the money is not enough. If 60% of the budget allocated to the health center is being utilized, you will see some level of improvement in the provision of equipment and human resources. That is at that level. And when that comes down to the hospital, you will not agree with me that 80% to 90% of all the doctors in the public health sector have their own private hospitals. And when the population comes to the hospital, after the management of the hospital have diverted their own, the remaining ones, like those groups you mentioned, ordinarily will be in the hospital. Those needles, those emergency drugs, ordinarily will be in the hospital. They may not be having enough. But the doctors will divide them to their own private hospital. And so this is the condition we find ourselves in this country. The doctors will tell you that the commissioner has taken their own, the management has taken their own, and so this is their own. So we are now kept in a position where we have no option than to provide basic health things for ourselves. And so when the emergency things come up, it consumes us. And we cannot overcome them until this systemic corruption is put to an end. That's not the way I see it.
All right. Thank you. And one thing you said, I think it's worthy of note. That would be the fact that some of these doctors have pharmacies. They have so some of the hospitals you go to, the public hospital. I don't want to mention names before they'll come for me. They'll come for my head, as though the thing that we will say is not happening. And so there's a problem. You say what is happening, what you have seen, what you have experienced, but you say it, and somebody would say you are lying, and you are wondering. Okay. We have gone to many of the hospitals. We know. I've been to one very popular one, public hospital, a national one, and you are told to go and they will even tell you that at that pharmacy is one of the doctors that own it. He would have it there. Go and buy it there. After the commercial, there's more. Stay with us.
You are tuned in to
Nigeria Info. We'll be right back.
or don't know. And even for the few that already know, you've never tried to use it. And for those that have tried once or twice, because you were disappointed, you bothered not to try again. But I'll make that revelation shortly and you'll find out. Very interesting. But first, let me rewind to my response to something that a caller mentioned while he was talking about some of the things that he felt is happening within the health sector that is contributing to this slow response when we have emergencies and even poor services. And it's not something that should be put on the laps or on the heads of doctors and nurses alone, but has to really be coming from the top, the government, not even just the management of the hospitals, but the government, because you cannot understand why some very simple things can't be found in a hospital. Some basic things are not in place. With the resources available, how difficult can it be to effectively improve the health sector? 0817-923-0007. You're aware that many people have lost their lives as a result of burns from the gas explosion. Well, these people, some of them, if not most of them, were successfully taken to a hospital, but unfortunately, some could not make it. Perhaps their conditions were very bad, and no amount, let's put it that way, no amount of medical attention could have saved them. Because that's what I'm pretty sure you would hear from some of the hospitals or doctors and all of those. Beyond that is, do we even have the necessary enough amount of medical service that those people could have gotten to help their situation? Do we have it? Do we have it? I'm talking, sometimes you see how far doctors go. Don't think we don't have great doctors in the country, because we do. But do we have the tools that great doctors can work with? If we don't, what are we doing? In Rivers State, the government has promised a lot. The governor has talked about zonal hospitals, bringing them up, ensuring that they work fine. I am not against building the hospitals. I've always loved building hospitals, schools, and all these things. Where I have a problem is the system that will run that building. And I think that's where many governments, past, hopefully not present, have gotten it wrong. The system that will run the building, the structure you've put in place with all the fantastic equipment. But how can it even work when we have a situation where the political leaders will go and build their own private hospitals rather than solving the problem of the public ones? They would rather take advantage of that problem, build a private one, use government influence to equip it for themselves and the people that have enough money to go use. Well, 0817-923-0003. Who then are we going to put the blame on? Because I think the most now is who to blame. If we have had some of these things in place, I said before, perhaps Ayo and many others like him who were affected would still be alive. Unfortunately, the emergency was not emergency enough, perhaps. Robin in Eche, let's start with you. Good morning.
Good morning, Andrew.
Good morning.
And greeting again to you. Happy New Year to you.
Wish you same.
Andrew. I am a proponent of blaming government in any of this issue. Why? Because we have surrendered our sovereignty to a system. And those who are in charge, from the president to the councillor, are the people we have remerged our authority for them to represent, solve our problems, and give us a better life. The problem is government. You see me, Andrew, you are aware as we are speaking now that 225 budget by the president is lying at the National Assembly. Am I right?
Mm.
So, are you telling me that they are not aware that the doctors and nurses have been shouting no hand gloves, no this, no that in the hospital? Is that no budget for the for Ministry of Health? It's a big problem.
I do not blame them all, because Socrates saw it even before Christ was born. The fall of democracy. He saw it. That I have a dream. And Davis will not lie to me. The people would want freedom. The women will give them freedom. The women who want freedom, want to be like the men. Gender. They give to them. A stranger who would like to have a right like this, the government gives to them. It will come a time when criminals will occupy offices. And the society will be very chaotic. That is what we are having now. If not have we have budget every year and we are carrying the same thing every year. The government is approving budget to service air fleet and all that. To God be the glory. You see me, Andrew. The government is culpable in this manner and in this matter.
All right, Robin, thank you. Let's go to Ubimini. Ken on the line. Good morning, Ken.
Good morning, me, Andrew. If you ask me, I think I am aware that during 60s, 70s, and 80s, there was this orientation of attend to your patient before you talk of money. I don't know if you are getting me. But this time around, the mindset of these new generational doctors are deposit before we attend to you. Because the government is not taking the health sector as their priority. Otherwise, every year in their budget, they talk about how to handle the military, how to handle the civil servants, how to handle the police and other parastatals. But they are not focusing on the behaviors, the dealings, and the welfare of the doctors. That is why some of these doctors have their own private hospitals where they will perform perfectly in their own hospitals in order to make their names. Whereas in the public hospitals, they behave as they like. So if you ask me, I would say that the government should have the pain because they have nothing, no agency, no orientation, no attention to make sure that the doctors treat their patients very well. Thank you very much. That's Ken, calling from Ubum.
There's Ken, thank you. Say before it was attend to your patient before asking for money. My brother, the problem now is do they even have the tools to attend to the patient? Sometimes the drugs that the patient needs, it's not in their store. Some of the tools, the equipment that they need to attend to that patient first. Let's even leave before money. If they want to attend before money, some of them don't even have the equipment, the drugs, the medication, some of the things that they need are not there. They begin to improvise and try to. That's the reality that we have in most of our public hospitals. That is the reality. And it's painful, and I wonder how commissioners for health, government, politicians go to sleep at night comfortably. Maybe because they have the monies and they have big private hospitals, or I don't know. But I would wonder how you would be able to sleep if something as basic as that cannot work on its own. Like, just that simple. I'm not talking about workers' welfare, salaries, and all those things, which are the things that we focus on every time. Something as basic as even syringe. There are hospitals in this state, let's not go to the country, where syringes are a problem. They don't have enough. Syringes, they don't have enough. Drugs, they don't have enough. They don't have enough medication in their storehouse or whatever they call the pharmacy or whatever they call the place. They don't. And somebody goes to sleep and you call somebody to want to talk to them and they will tell you they are busy. Yet nothing is changing. But that's the reality of what we have in our health sector now. Chima Rumokuta, good morning.
Good morning, Mr. Ifemi.
You're welcome.
How are you doing this morning?
All right, good morning. We're fine. Go ahead, Chima.
This story of this gas explosion in Orange is really breaking my heart because it's reminding me of what happened to me. I am a direct casualty of the gas explosion. That's why whenever I hear about this fire something, I will make sure I will try and talk, even if I have nothing to talk. My mother, my elder sister, my niece, and housemaid are all victims of this gas explosion, and they're all dead. And what happened is that where she was living, she got gas explosion. She drove by herself in her car, SUV, carried all these people that are involved to a hospital called Sonabel at Orazi. A first-degree burn. They were all shining white. When we got the information, we were looking for her that evening. We were running around. We didn't know where she was. We've looked for her the whole because somebody had to borrow her phone from the hospital, and she called her. She said, Sonabel, we should come with money. Do you know the doctors that refused to attend to her? This is not a government facility. It's a private, well-equipped hospital. They attend to any of these, upon the little minors that we are there, they attend. They said they need money first. By the time we got there, we saw them in the car, just like that, before we have to start paying for emergency before they start carrying them in. Now, when we're talking about this thing now, yes, the government should be faulted in this thing. But what about we individuals? How wicked are we? How wicked? How myopic are we in business? Now, you're talking about the government men that used to go and establish outside the government facility with government money. If they had done inside the state, it's better. The orderly, our former governor, is he in the last information that he built one of the most influential hospitals in South Africa? Even if we want to say we want to call names, we are angry now. Let us begin to talk so people will know that we are angry. The hospital that is being built in South Africa, even if you are built here, it was to improve our health or our business, whatever, in a river state as a whole. Now, what are we talking about? If we talk about the government at hand, we will not live here today because the strange energy you're talking about, we were about to put this here in River State. What is the River State governor doing? Now, if other hospitals have been built by the past administration, what is this administration doing to open them up? Let us see them first, whether they are working. Now, the issue here is that now, if I give an answer, you will say what is happening to me. I will tell you so many things that you will not believe. I'm very, very angry. But the issue is that we individuals, we are wicked to ourselves. Because one, that man that is working that thing there, I heard that they have gone to him one or two times to tell him that what he's doing is bad. But the people around there protected him. They'll be like, what it concern you? The man they find in Bel Air, maybe they find. Even the landlord there, I heard the landlord there even confronted somebody that was talking to him that I don't pay my rent, it's my tenant. So this is against that you are passing, you see somebody being bad, you want to talk to him, they will start at you. You know, I'm in the hustle, in the struggle. A woman selling akara at the front of the road that will cause accident. You go, madam, say akara, hey, you're not going to leave the poor woman. You know, that is our mentality in Africa. In River State, in Obiako. Sorry, my name is Chima.
All right, Chima, thank you. All right, thank you. I like the fact that you're upset. First off, I don't have any information about a hospital in South Africa by former Governor Dr. Peter Odili. I know that he is a doctor, seasoned one, so it's something that he's practiced and it's good with that. But there's the Palmer Hospital here in Rivers State. I don't know who owns that. Perhaps you tell me, or who runs it. I don't know. But I'm pretty sure that hospital is contributing immensely to medical issues in the state. But that's not even the case. I don't have a business or a concern with anybody that has a private business or hospital or who owns what. I don't know. My point here is simple, and it's one thing. The place that the common man can go is that public hospital. All the national and state public hospitals are the places, the primary health care centers. That is where the people can go easily first. So if those places are not functioning up to standard, what is the point? Because they are the ones that should have the most resources. Unfortunately, they don't appear like they do. Even though we hear on paper, we hear all the promises from government. I don't think it's my next question because I've asked it before. How difficult can it be? Maybe because I'm not in government, I don't understand. And maybe I don't understand because nobody in government is telling us the truth. But how difficult can it be? You get a contract to supply medical equipment. The first thing you are doing is the money that you will get out of it. Some people are even building the hospital. They are building the hospital because of themselves and their friends. It's not because of the poor people in the streets that can use it, because at the end of the day, you can't even afford what they are putting there. Our primary healthcare system is in a mess. Zonal hospitals, there's almost nothing you want to write them about. If we had, do you know, let me even shock you the more. Do you know that in this country we have an emergency call line? an emergency number for ambulances. Do you know that Nigeria has an emergency number for ambulances? The number is 112. Try and dial it and tell me what you see or what you get. Just dial it. In fact, while they were advertising this number, it's a toll-free number to tell you to connect the callers to the emergency contact center, which is ECC, and then they will dispatch the appropriate ambulance service. Oh, so fantastic. Dial it as we're talking now. Dial it and then let me know what happened. Bob in Mbiama, good morning.
Good morning, Andrew.
Yes.
Yeah, like others have said, Nigeria, somebody told President Buhari in the United Kingdom, London, say Nigeria is fantastically corrupt. I'm telling you, the leaders, they don't have that heart. I don't know what they will come again to campaign for. You see, if it is the time of Jonathan, where we'll have this tanker fuel bomb in Okobe, the people will have all died. Because the bomb is more than what we have now in this gas explosion. But they rescued so many people. Amici himself cried, shed tears, come down to the place, visit the hospital, and paid for their emergency treatment immediately. Some could not handle their West and so to them so many other places. So they see them now, some don't have eyes, but they are able to rescue them. Compared to this one. Please, I want to tell the government they should be proactive, not reactive. The other people are going to visit the place. But the place they are visiting, like you said, how was it equipped? Even while we are accounting for this fuel issue, government have their own sort of fuel. They don't care for the people. Anything about the market doesn't concern them. Just the fleet of SUV, Escalade, vehicles, private jet, whatever they can get. Forgetting that they will die the same day, the same way come and die, and go the same place and start querying. You see, it breaks my heart the way politicians are behaving. They are not there to serve the people, but to serve themselves. And they just bring small rice. They will give them rice, give them pepper, give them this one. That would be the hospital is real in South Africa. It was real. If you have not had it, here it's the second time again from me. It's real. How did he convert that hospital to himself? That hospital is real. Thank you.
All right, Bob, thank you very much. Okonkwo in Rumokuta is on the line. Good morning, Okonkwo.
Good morning, brother.
You're welcome.
Often and on, and our direct understanding and knowledge, many of our politicians fell sick, seriously sick. They went to Italian hospitals, Indian hospitals, German hospitals, America, London, and they fully recovered and came back to this place because of the comparative and competitive hospitals there. Brother, fear me, if we are to have that type of hospitals here, do you think that any of these fire victims would have died? But they go there and see those qualified and competent hospitals, and they treat themselves. I want to ask a question. Why can't they come here and build those types of hospitals here? So that the citizens of this country will not carelessly be dying. Why have they left this country empty? And these disruptions are going on. I am concluding, if it had to be in advanced nation, right from where this incident happened, ambulances with air conditions would have been there. And the first treatment that would have been given would have been what is called anti-fire bomb. Anti-fire bomb, lubricating substance would have been poured on their bodies before they would be put on the air-conditioned ambulances to the hospitals, and they would have survived. I don't know. Do we really have hospital? Do we really have government in this country? Thank you.
All right, thank you very much. Victor and Remo Krushi, let's hear you now. Good morning. I will lost a call from Victor. On Facebook, I'm pretty sure we have several messages there, so I'll just go take a few of them. At Nigeria Info 92.3 PH is the handle on Facebook for those of us who are yet to like the page and join the live stream. So you can watch and listen to us online at Nigeria Info 92.3 PH. Some of the comments here. Gordon Agwawan says, concerning this matter, the people that should take the blame are doctors, because in some hospitals, only when you make a deposit or make the first payment, that's when you'll be attended to. Blessed Ola says, Andrea, I've dialed emergency number, which is 112. What I'm hearing is that my call cannot be completed. I should try again later. Imagine this, Andrew. If there's any emergency at all, is it what? They did not tell you that it's trying to get your location. I think that's the first thing to say. Trying to get your location, and then that will happen for a while, and then nothing comes on, and then that's it, you're done. Concerning I think we had that. Blessed Allah. Situation of this country, medical attendants cannot be attended to their patients until you make deposit. And the major problem is some of those hospitals don't have what it takes to even carry out some of the treatments in their hospitals. I'll take two more. Magnus and Victor. Magnus from Mount 3. Good morning.
Good morning, Andrew.
Yes.
The issue we are discussing this morning is very important. And it is key to the state development and the national. If you go to our government hospitals, I can tell you categorically that 95% of resident doctors, they have their own private hospitals. If I was opportune to be with my mother during her eye surgery some time ago, and then what the doctor told us that there is this private hospital that she wants to refer my mom to for the eye surgery. Okay, we said no problem. We got to that hospital and we discovered that the owner of that hospital was the same person that referred us to that hospital. In fact, she was the person that operated my mom. These things are happening in the state.
But did she refer you to that hospital because the hospital that you came had equipment and then they didn't want you to do it there?
The hospital does not have the
exactly.
And it is government hospital.
Exactly.
So does it mean that the government did not provide equipment to that hospital?
That's what it should be.
Is no. Government has been doing a bit divert the things to their private hospitals. That's the problem. Both the equipment, the drugs, and everything, they will share it and divert it to their own personal hospital. So when you go to that government, they say, they will refer you that we cannot handle it, go to the hospital. When you get there, it is their own private hospital. In fact, it was the same woman that operated my mom. They will take 2 weeks off. That 2 weeks that they are going off, they are attending to their client, their patient in their private hospitals. So I want government to, as a matter of urgency, look into this situation because it's very terrible. Someone mentioned Sonabe, what happened at Orazi. And I must say that I think the government is working. Government should get most of those nurses or those who want it arrested. It is because of their negligence that most of those victims died. We need to do things right in this country, especially here in Rivers State, because we cannot control like this.
Magnus, thank you. Victor, unfortunately, Victor from our 3, we will not be able to take your call because we're already out of time. Thank you to everyone who called. All I can say is have a conscience, leaders, commissioners, anybody in government that's supposed to do something for people, have a conscience. Just small, past is a small conscience. Just have to understand that. Do the right thing because you do not know how it's going to come back to bite you. It could have been your cousin in the village that went down to that place and that explosion happened. And because you were in charge of delivering equipment or doing one contract to do something, you did not do it well. He went there and then they could not attend to him. He died or she died. Let's do the right thing. My name is Ifeami Andrew. Hello, Port Harcourt is next. Good morning.
The show continues after.